Hello, this is the NICU Lived Network, and we are your hosts. I'm Melinda.
I'm Nat.
And I'm Emma. We are all NICU mothers using our lived experience to partner with health professionals to impact research, advocacy, and clinical practice.
Each week we will bring you something new. It could be a topic highlight, the latest in research, a visit to a NICU, or ways in which you can use your lived experience within the NICU to impact change. We hope you enjoy this episode.
Hi everyone, it's Nat here. On this week's episode, we take a look back at a conversation that Melinda Cruz had with 3 other neonatal research doctors about research trials, why they are important, and how past trials have helped shape healthcare today. The doctors will also touch on how they feel about parent involvement in research trials. Enjoy today's episode, and we'll chat to you guys next week. Bye.
So we're going to jump straight into it, and I'm going to let these 3 incredible gentlemen introduce themselves. So we'll start with you, William.
Hi there, my name's William Tarnow-Mordi. I'm Professor of Neonatal Medicine and Director of Neonatal and Perinatal Trials at the NHMRC Clinical Trials Centre at the University of Sydney. And I've been involved with trials for probably more than 30 years. And so I'm a real enthusiast, but I do recognise how important it is to share why trials are important with everybody, particularly parents.
Awesome. Okay, Michael. Yep.
Hi everybody, my name is Michael Stark. I'm an Associate Professor of Neonatal Medicine in Adelaide, and I'm an active trialist, currently a PI on a large multi-centre randomised controlled trial, and we found that the involvement of parents was critical in the design and getting the study running, so it's a real pleasure for me to be here today.
And Tim.
Thanks. My name's Tim Schindler. I'm a staff specialist neonatologist at the Royal Hospital for Women in Sydney. And like Michael, I'm a very keen trialist and leading our site in a multi-centre randomised control trial at the moment.
And for those of you that don't know me, my name is Melinda Cruz. I'm also the mum of 3 boys who were born premature, and spent time in the NICU with them. And for me, when I reflect back, I realised that research wasn't something that was presented to me at times. So when I was a parent going through it, it's not something that I thought of. And for me, I look back, and William, you and I have had this discussion before, that if I'd been approached at the time, I don't know whether I would have said yes, because research seems, as a parent trying to make that decision for your baby, it can be quite a scary process. So it's amazing to have you here today to be able to talk about that and to really get parents and help them to understand what trials are all about and what's happening within the NICU. So Tim, I might start with you, if you can explain to families, what is a randomised trial?
So there's lots of examples in medicine where we don't know what to do in certain situations, and there'll be considerable debate between doctors as to which medicine is better than which other medicine, and ultimately we never get an answer to that unless we do a trial. And so the whole idea of a randomised trial is that we randomly assign participants, so for us that's babies, to the 2 different sides that people think is the right thing to do for babies. And by randomly assigning the babies, you make the babies even in terms of the 2 groups, and it gives you an answer as to what the best thing to do is, so that you can do the right thing for every baby going forward, rather than the right thing for some babies and potentially a harmful thing for others.
Yeah. So William, do you want to give us some examples of the history of trials or trials that have used the randomisation process?
Well, I think the first thing to say is that the outlook for babies, sick babies, premature babies, has never been better than it is right now. And that's largely thanks to hundreds or even thousands of randomized trials in millions of babies that have taken place over the last 50 years. I think some of the landmark examples of randomized trials that have transformed the outlook for babies are the randomized trials of antenatal steroids, where pregnant ladies who are at risk of delivering preterm were randomly assigned to either have steroids, betamethasone or dexamethasone, or placebo. And what those trials showed was that there's a 30% reduction in neonatal mortality by having the steroids. And we didn't know that before. And as a result of finding that out, millions of babies by now have benefited. Another example are the trials of surfactant, which came out in the early 1990s. And surfactant trials were done relatively quickly, and they showed something similar, that you could reduce the risk of a baby dying by about 25% or so by giving surfactant compared with what had been normal care. So those are two really important examples of how the outlook for babies has been advanced far, far beyond what was possible at the time. And we wouldn't have got there without these two randomized trials.
Michael, did you want to add anything?
They're central to what we do now in neonatal medicine. I think it's a specialty that provide exemplar trials. They're so well designed. And what we've become increasingly aware of is really the importance of having parents involved early in their design, because what we want is the best thing for the family as a whole. And being selfish, it means that our recruitment is good as well. If parents find the trials that we're pitching to them sound like a really good idea. So letting families know about trials, why we do them, the importance of them, I think is a really critical thing.
Mm-hmm. And I think, as a parent, we intrinsically know that our babies are doing well and get better in the unit because of past babies and past families that have said yes to trials. So I remember, I met a gentleman, he was born in 1972 and he was the earliest surviving baby in New South Wales. And he had, because of his prematurity, had really severe blindness. And, I remember talking to him and, explaining about my kids. And he said, his name was Michael. He said, I know what I went through helped your babies. And I said, yeah, like it was just this moment between us, knowing that, what he went through, what past babies went through, meant that my boys had a better chance. So I know as parents, we have that immense gratitude. So, it's amazing to want to be able to, I guess, open that door and really invite parents in. And when you talk about parents being part of the process, you're talking about parents who have gone through the experience, have that lived experience like I do, now coming back as a representative and a voice for other parents to assist in the design of trials. Is that right, Michael?
Absolutely. I think we need to remind ourselves that centres, hospitals which are active in research and active in randomised controlled trials have been shown time and time again to have better outcomes. It's really important. And we can keep on doing them better.
So, William, can I ask you just to explain that point? When you state that babies do better in a trial, can you expand on that? Because I find that really interesting, and I think that would be something really important for our families to know.
Yeah, there is increasing evidence that babies who are entered into a trial, particularly a phase 3 trial, large trial, whichever treatment they get, they actually have a better chance of surviving and doing well than if they just continue to have usual care outside the trial. And there are a number of reasons for that, but one of the main reasons is that by the time you get to doing a phase 3 trial, which is a large trial in hundreds or thousands of babies, there's pretty good evidence that that treatment that you're interested in is going to be effective. And so if people have a 50% chance of getting the more effective treatment, then they're much better off being in the trial than standing on the sidelines and just having usual care. And I think there's more and more evidence that that's one of the benefits of being in these large trials that needs to be explained, not sensationally, in neutral, what we call non-coercive language, but we need to explain that a little bit more clearly so that people are in no doubt that it's not harmful, it's not risky overall, on average, to go into these trials, particularly these phase 3 trials. Mm-hmm. The thing about any trial is that you can never predict in advance what the outcome is going to be, which treatment is going to be better. But because on average, about 55 to 60% of the newer treatments turn out to be better, then you're best to be in that trial rather than not.
That's a wrap on another episode of the NICU Live Network. Thanks for joining us today. To stay connected, please make sure you're following us on social media and have joined our Facebook group.
And if you found value in this episode, please share, like, or comment.
We'll see you on the next episode.